Hello. I wanted to get on here and chat with you guys about a few things as I take my drive home today because I keep getting the same question and I wanted to break this concept down so that you completely understand it. You know what the question that I get every single day is? It's why isn't my plantar fasciitis going away? I've done all the things that my doctor told me to do. I've done all the things that YouTube told me to do. I've done all the things that TikTok influencer that I follow that healed their plantar fasciitis told me to do, and I'm still not better. And the reason why people struggle so much with this condition, and plantar fasciitis is by far one of the most common foot problems that I treat as a podiatrist. The reason why people struggle and they get stuck is because people don't understand this one concept. They don't understand the importance of identifying what's actually causing it, right? And so there's so many different treatment options that are out there. There are so many different things that are out there because when it comes to plantar fasciitis, you must treat your root cause and not your symptoms. So let me give you this as an example. If you took 5 people that have beat heel pain and beat plantar fasciitis, and you asked each one of those people, what was it that did it for you? What was it that finally got you the relief you've been looking for? You would 100% get 5 different answers. Why is that? Why is it that stretching helps with one person and it doesn't do anything for another person? Why is it that icing the foot helped one person and made it worse for another person? Because each individual person has a different root cause as to why they actually are developing plantar fasciitis. And we have to also take into consideration the uniqueness and the lifestyle of the individual, right? All of those have to be taken into consideration to be able to get the results that you're looking for. So, what I wanted to do today is I wanted to take some time and go over what are the 5 root causes of plantar fasciitis. Now, these 5 root causes are things that I have discovered over the past 10 years as a practicing podiatrist. And so I made the mistake in the beginning by treating every single one of my patients that came in with heel pain the same exact way. I unfortunately made that mistake. Every single person that used to walk into my office got the same thing. They got an injection, a handout, and some inserts, right? And so what I found out is that that combination doesn't work for everybody. And I began to have more and more people who weren't getting the relief that they were looking for. And I realized, you know what, I'm missing something here. I need to go back to the drawing board. I need to read the patterns. I need to understand this condition better. And what I found that there were 5 things that could be driving your heel pain. And it's important that you identify that first before you attempt to treat anything, because that root cause is going to determine what you do, including what shoes you wear, what inserts you wear, what stretches, if any, that you should be doing, right? So, what are those 5 root causes? Number one is biomechanical dysfunction. What does that mean? So, our foot is our foundation. And just like a foundation of a home, you need a stable foundation. However, there are other things that contribute to the chain that I call it, right? So the foundation, the very bottom of the building is our feet, and then we have the other joints above it. So we have our ankle, our knee, our hip, and our lower back. And so when one of those are off, it can increase the strain that's happening down on the foundation, right? And so let's say you had a hip problem, arthritic hip, that caused you to walk a little bit differently. Unfortunately, because the feet are the foundation and it's at the end of that chain, a lot of times it increases the strain that's happening on your foot and you can flare up your plantar fascia, right? So that's root cause number one, biomechanical dysfunction. Number two is inflammation. So the thing about plantar fasciitis is that oftentimes it's categorized as an inflammatory condition. Can it be? Absolutely, especially in the beginning phases of it. But if you've had plantar fasciitis for some time now, you probably have very little to no inflammation in your plantar fascia, and you more than likely have tissue degeneration. So, but there are other inflammatory conditions that could be contributing to your plantar fascia. What do you mean by that, Dr. Varner? If you have, for example, autoimmune disease like psoriasis or rheumatoid arthritis, those are conditions where your body's inflammation is out of control, right? And so it's gonna inflame soft tissue structures more frequently than someone who doesn't have those conditions, right? And if you're at the beginning phases of plantar fasciitis, you probably do have a lot of inflammation in that soft tissue that needs to be addressed, okay? So we've done the first root cause is biomechanical dysfunction. The second root cause is inflammation, right? The third root cause sometimes is neurological. What do you mean by that? Yes, neurological. So what that means is this. Next to your soft tissue is a nerve bundles and nerves that are in that area. And sometimes what we can do is because of the pain, it changes how we move and we walk, and we can actually irritate the nerve. So sometimes it's mistaken for plantar fasciitis, right? So what we want to do is make sure that we identify that, because if the nerve is really the problem and not the tissue, that's a totally different treatment option. Stretching a nerve problem is not going to help it, right? All right, so that's number three. So number one was biomechanical dysfunction. Number two was inflammation. Number three is neurological. Number four is metabolic factors. What do you mean by that? Do you mean to tell me that other factors in our body could be contributing to this? Yes, that's what I mean. So metabolic factors are things like diabetes, things that actually affect your body's ability to heal tissue, right? And so having these different things under control, or at least addressed, helps you heal faster and better. And if you don't, and those things are rampant, then I don't care what kind of stretch, I don't care what type of insert you're wearing, it's not going to get better. Last thing, and cause number five, is recovery deficit. What does that mean? That means that you are not giving your body enough time to actually recover. So that includes both the amount of time that you're spending on your foot and your body and your ability to have good, healthy sleep. So we know that a lot of tissue repair occurs when we're asleep. And if you're not getting much sleep, if you're spending 10, 12 hours a day on your foot, there is no way that that tissue is going to be able to recover, right? So identifying which one of these five things is driving your heel pain is the very first beginning step, right? Without that, you're just guessing. You're just trying a bunch of things. And once you understand which one is driving your heel pain, then treatment options become a lot more clear, right? So I like to help people discover this. And so what I do is I host various workshops. And what we do is we actually discover which one of these five root causes is actually driving your pain. And one thing that I found out as I've done many of these workshops and I've worked with patients over the last 10 years is that normally it's more than one, right? And so it's important to know what to start with, when to start, and how to actually implement the inflammation. But the first step is discovering your root cause, right? So if you're interested in discovering your root cause and you want to learn more about what's driving your pain so you can stop guessing and finally find relief, then you need to be at my next workshop. You can register for my next workshop by clicking the link in my bio or clicking the link below, and I'll send you the registration right over. All right, that's all that I have for today. If you have questions about your feet, please leave them in the comments. If this is something that is helpful for you, continue to watch, subscribe. I post as often as I can, and I'm here to help you. This condition is something that can get better, and I want you to believe that. But you have to stop guessing, and you have to know which direction to go now. All right, that is it. You guys have a wonderful evening, and I'll talk to you soon. Oh, and remember, when your feet feel good, everything else gets a little easier.